If you can remember the 9 assessment steps in this module, you won't miss anything when you're caring for patients with chest drainage. To make the steps easy to remember, we'll use colorful photographs that will jog your memory. We'll start at the patient and work our way down and through the drain. The first step is to check the dressing. Make sure it's dry and occlusive. Dressings around chest tubes do not need to be routinely changed. Next, check the tubing to see if there are any dependent loops. You know the kind that make drainage go uphill to get into the collection chamber. If you see a dependent loop, remove it by coiling the tubing on the bed for gravity drainage, the same way you would do with tubing for a Foley catheter. Good research has shown that there's no need to strip or milk chest tubes to enhance drainage. These maneuvers can expose the patient to dangerously high negative pressures in the chest that can damage lung tissue or the heart, depending on the tube's location. Now you can start checking the unit. First, you come to the collection chamber where you'll check the drainage. Note the amount and type of fluid. You can mark the level right on the front of the drain. Next, check for bubbling in the water seal chamber. Bubbling indicates air is entering the system and being vented out of this chamber. If there is no bubbling in the water seal and the patient has a pleural tube, look to see if the water level moves up and down with breathing. Called tidling, that's normal and reflects the intrapleural pressure changes that occur with normal breathing. Now check the level of the water in both the water seal chamber and the suction control chamber, since water will evaporate from the chest drain. More quickly if there's bubbling in one or both of these chambers. Add fluid as needed. Adjust the vacuum source so that there is gentle bubbling in the suction control chamber. Once bubbles appear, excess negativity is vented. Vigorous bubbling does not increase the negative pressure, but it does make a lot of noise and hasten evaporation. Finally, follow the tubing from the drain across the floor and to the vacuum source, which is usually a regulator on the wall. This tubing should remain open so air can leave the system. It can easily get pinched by the wheels of equipment at the bedside.